Hi, I'm Dr. Harpreet Bhatia, a preventive cardiologist at the University of California, San Diego. I'm here today on behalf of the Family Heart Foundation to discuss the importance of screening for lipoprotein a. First, what is lipoprotein a? So elevated lipoprotein a is one of the most common genetic causes of cardiovascular disease, affecting approximately 1 in 5 individuals across the world. In some populations, the prevalence of the condition is even higher. Elevated Lp(a) is a genetic condition, and someone's Lp(a) level in their bloodstream is approximately 90% determined by genetics. This is why you don't necessarily need a genetic test to better understand whether you have a harmful mutation. It can be based on a simple blood test that determines the level of Lp(a) circulating in the bloodstream. Elevated Lp(a) is an important cause of premature cardiovascular disease in the prime of life. And again, a simple blood test is all that is needed in most cases. But this test, unfortunately, is not part of the normal care of most patients. And so 95% plus of Americans have never been screened. Why should we care about Lp(a) and why is it important to get screened? Levels of lipoprotein or Lpa circulating in the blood are 90% approximately determined by genetics. As many as 1 in 5 people have inherited a mutation that makes their Lp(a) levels high enough to put them at increased risk for premature heart attacks or strokes. If you have an elevated Lp(a), what can you do about it? First of all, we know that it increases the risk of multiple different cardiovascular diseases. So at the minimum, it can be used to make a more precise estimate of your cardiovascular risk going forward. Second, it's important to address global cardiovascular risk. So we know that if we optimize someone's cardiovascular risk factors aside from Lp(a), that can significantly reduce their overall cardiovascular risk. One of the most important tools that we have is lowering the LDL cholesterol. And if someone has elevated Lp(a), we are very aggressive about lowering the LDL cholesterol even more than we would typically to address the increased risk mediated by Lp(a). There are many different treatments that we have for lowering LDL cholesterol, and Lp(a) may help to guide the decision making and the choice of drug therapy for LDL cholesterol lowering. For example, statins are the cornerstone of preventive cardiology and the prevention of cardiovascular disease. But PCSK9 inhibitors have been shown to have some modest lowering of Lp(a). And if someone is a high-risk individual and otherwise qualifies for a PCSK9 inhibitor, that may be the drug of choice if they also have an elevated Lp(a). There may also be a role for choice of antiplatelet therapy. So in the primary prevention of cardiovascular disease, preventing disease among people who have not yet had a clinical event, there may be a role for a daily baby aspirin in people with high Lp(a). Similarly, if people have had coronary revascularization before, such as bypass surgery or a stent in their coronary arteries, there may be a role for prolonged dual antiplatelet therapy after revascularization due to the increased risk of recurrent events and recurrent revascularization in individuals with high Lp(a). Additionally, because Lp(a) is genetic, identifying an elevated level can help inform the family's risk and lead to cascade screening, which is a very effective method to identify other individuals who may be affected with elevated Lp(a). There are also a lot of potential treatments not too far off on the horizon for elevated Lp(a) with multiple clinical trials ongoing. And to be able to enroll patients in trials and be able to offer this opportunity to them, we need to identify individuals with elevated Lp(a) by testing them and by screening them. One of the things we hear back from the Family Heart Foundation community is how important understanding you are at risk can be, and how important that is to lead to listening to your symptoms and adhering to treatment regimens for LDL cholesterol. Hear things like, I wouldn't have ignored my symptoms, and I would have gone to the hospital sooner if I knew that I was at increased risk. Finally, what can you do now? So in addition to management strategies, as we discussed earlier, it's really important to get screened. So the Family Heart Foundation provides free LDL cholesterol and Lpa testing and free one-on-one support through its Care Navigation Center. You can visit cholesterolconnect.org for more information. It's really important to know your numbers, know where you stand right now. So understand your LDL cholesterol and visit the LDL Safe Zone at familyheart.org. You can access free tools, one-on-one support, and connect with people who are living with elevated Lp(a). But most importantly, it's important that you advocate for yourself. It's important to know your risks, know your numbers, and get the support that you need. Talk to your doctor about actions you can take today, such as steps to aggressively lower your LDL cholesterol, managing your diet and all your other cardiovascular risk factors, and the potential benefits of something like a daily aspirin or particular choice of lipid-lowering therapy. Thank you. I'm really happy to be here to be discussing this important topic and hopefully increasing the awareness of elevated Lp(a) because it's such a common and important genetic cause of cardiovascular disease. And we need to be able to identify individuals who are at increased risk earlier so that we can intervene and potentially offer them targeted therapies in the near future.